Let's talk about hereditary thrombophilias. They are the autosomal dominant disorder resulting in hypercoagulable state, increased tendency to develop thrombosis. Again, what is it? It's in a hypercoagulable state. Why? Because you have some autosomal disorders. These are here. We have, first thing is the antithrombin deficiency. Has no direct effect on the PT, PTT, or thrombin time, but diminishes the increase in PTT following standard heparin dosing. Can also be acquired, which would lead to renal failure, nephrotic syndrome, which leads to antithrombin loss in the urine. We know that in nephrotic syndrome we have this. And this leads to decreased inhibition of factor 2A and 10A. Okay, so that's the antithrombin deficiency. Again, looking at this point, which is really important, they said that it has no direct effect on PT, PTT, or thrombin time, but diminishes the increase in PTT, inhibits something, or decreases the increase in PTT following standard heparin dose. So because the heparin, remember heparin has heparin increases the activity of antithrombin, and that then works. But when we have the antithrombin deficiency, so you don't see any increase in PTT because you're even deficient. The way it works is you don't even have that thing. You don't even have antithrombin. So you have a diminished increase in PTT following standard heparin dosing. Second thing, factor V laden. In factor V laden, what do we have? We have a production of mutant factor V, which is through the guanine into adenine DNA point mutation, which leads to ARG 506 whatever mutation near the cleavage site. Again, you just have a mutant factor V now. You have a mutant factor V that is resistant to degradation by activated protein C. So when you cannot, the protein C cannot degrade your factor V because it has mutation in it. It is a mutant because of its mutation. Mutation is in the guanine to adenine DNA point mutation, which leads to some complications, which are DVT, cerebral vein thrombosis, recurrent pregnancy loss. Excuse me. So, again, one more thing here. You will have single amino acid substitution. What do you have in this? What was the problem? Single amino acid substitution. Okay. Now, we have, it can lead to DVT, it can lead to cerebral vein thrombosis and recurrent pregnancy loss. Okay, that's factor V laden deficiency. Let's talk about protein C and S deficiency. Decreased inability to inactivate factor V and factor VIII. Because we don't have CNS, we cannot inactivate factor V and VIII. This leads to increased risk of warfarin-induced skin necrosis. Together, protein C cancels and protein S stops coagulation. Okay, so when we don't have this, you have factor V and VIII present, and that leads to with the warfarin, it causes increases the risk of skin necrosis. Let's talk about the next one. We have prothrombin mutation. Again, it's a point mutation in the 3' untranslated region. This leads to increased production of prothrombin. This prothrombin mutation increases the production of prothrombin, which leads to increase in plasma prothrombin levels and venous clots. Venous clots, DVTs, cerebral vein thrombosis. So all seen in the thrombophilias, hypercoagulable states. Okay, so that's pretty much all we have for the hereditary thrombophilias.